My name is Carlo Gambacorti. I'm a professor of internal medicine at the University of Milano Bicocca in Monza, Italy, and I'm one of the lead investigators in the study 3000 that compared the Bosutinib to Imatinib in newly diagnosed CML patients. We have now the 24 months update of the study, which confirm a significant protection of patients from progressing to the most fearful and worrisome characteristic of CML, that are blast crisis and accelerated phase progression. We have a quite important protection of patients in the sense that the rate of progression in this category is diminished about 3 times in the patient that received Bosutinib compared to the patient that were treated with the comparator, that is Imatinib. This protection is a very solid evidence of the effect of Bosutinib, and in part overcome the limitation of not having achieved a higher cytogenetic response rate at 1 year, in the sense that cytogenetic response is used as a proxy for more solid endpoints like protection from transformation. And indeed, this study also showed that patients treated on Bosutinib were less likely to die because of leukemia progression than patients treated on Imatinib. This is another evidence for the effect of Bosutinib compared to Imatinib in this population of patients. It's true that in this study we had a significant number of patients that went off study because of adverse events. This, however, is in part due to the fact that the drug was mostly used in centers that had no previous experience with the drug, so they were a bit unfamiliar with the use of this drug. I can expect that with a wider use of Bosutinib, these problems will definitely be reduced substantially compared to the data presented in this study. The final consideration pertains to what can be taken home as general message from a drug like Bosutinib. We can say that this drug is quite safe, that we can have side effects as for any other drug, but that these side effects are definitely manageable. They are not risky. They don't put the life of the patient at risk, and they don't make the patient to risk an irreversible organ damage. So in a sense, Bosutinib is a quite safe drug, although it does not have, of course, the record in terms of years of follow-up and the patient that have been treated with like Imatinib. But among the second generation TKIs is definitely one of the most safest and active one.